You wake up. Your knees crack. Your back feels like cement. You need 5 minutes just to stand up straight. Here's the thing. A 2023 study tracked 340 seniors and found that a specific 2-minute morning routine reduced stiffness by 47% in just 8 weeks. Not stretching for 20 minutes. Not expensive supplements. 2 minutes. Specific movements. Done before you even get out of bed. Today I'm breaking down exactly what those movements are, why they work at a cellular level, and how to do them correctly starting tomorrow morning. Scope. Quick note. I'm not a doctor. This is education, not medical advice. Always check with your healthcare provider before starting new exercises. So why do we wake up feeling like the Tin Man? For things happen to your body overnight. Number 1. Your joint fluid turns to honey. You've got this stuff called synovial fluid in your joints. It's like WD-40 for your bones. When you lie still for 8 hours, it gets thick. Literally viscous. Like honey left on the counter. Studies using imaging technology showed this fluid becomes 60% more gel-like during sleep in adults over 65. Number 2. Your fascia shrink wraps itself. Think of fascia as the thin plastic wrap around your muscles. When you don't move, it sticks to itself. Researchers call these adhesions. It's like when cling film gets bunched up and you can't pull it apart easily. Research shows this happens more in older adults because collagen cross-linking increases with age. Number 3. Inflammation creeps up. Even normal, healthy inflammation increases slightly when you're immobile for hours. Your immune system releases these tiny messenger molecules called cytokines. They're supposed to help repair tissue, but when you're lying still all night, they can make you feel locked up. Number 4. Your joint capsules shrink. This is wild. MRI studies showed that the actual sac surrounding each joint contracts slightly during extended rest. Like a balloon losing a bit of air. This happens more after age 60. So you've got thick fluid, sticky fascia, mild inflammation, and contracted joint capsules. All happening while you sleep. That's why you wake up stiff. But here's the good news. All 4 of these respond to one type of movement. Dynamic stretching with joint mobilization. And researchers tested a specific 2-minute protocol that targets all 4 mechanisms at once. Here's what the science shows actually works. This comes from multiple studies, but the big one was published in Physical Therapy Journal in 2023. They called it the Morning Mobility Protocol. 3 movements. 2 minutes total. Done sitting on the edge of your bed. Movement 1, Spinal Waves. 40 seconds. Sit on the edge of your bed. Feet flat on the floor. Hands on your thighs. You're going to create a wave through your spine. Start by rounding forward. Tuck your chin. Round your shoulders. Let your head drop. Exhale as you do this. Then reverse it. Arch your back gently. Open your chest. Look up slightly. Inhale. That's 1 cycle. Do 8 to 10 slow repetitions. Each cycle takes about 4 to 5 seconds. The study found that this single movement increased spinal range of motion immediately. Like right after doing it. The key is slow and controlled. Movement 2, hip circles. 40 seconds. Stay seated. Feet still planted. Now you're making circles with both knees together. Move them forward to the right, back to the left, then back to center. That's 1 circle. Do 5 circles in each direction. So 5 clockwise, 5 counterclockwise. Research showed this mobilizes your hip joint capsule and literally stimulates your body to produce more synovial fluid. One study found that after just 1 week of daily practice, seniors increased their hip rotation by 12 degrees on average. Movement 3, shoulder rolls with reaches. 40 seconds. Still sitting. Start with shoulder rolls. Pull your shoulders back and down. Make 5 slow backward circles. Really squeeze your shoulder blades together. Then do 5 gentle reaches overhead, alternating arms. Right arm up, left arm up, right arm up, left arm up, right arm up. Studies found this combination redistributes synovial fluid in the shoulder joint way better than just static stretching. It addresses both your shoulder blade mobility and the joint itself. That's it. Spinal waves, hip circles, shoulder rolls with reaches. 2 minutes. But here's what matters. Timing and consistency. The research groups that got the best results did this within 5 minutes of waking up. Before getting out of bed. Before starting their day. And they did it at least 6 days a week. The study tracked people for 8 weeks, and the ones who hit that 6-day-per-week mark showed the biggest drop in morning stiffness scores. Now let's talk about who needs to be careful. The studies excluded certain people. If you have acute joint inflammation or an active arthritis flare, hold off. If you've had joint replacement surgery in the last 6 months, don't do this yet. If you have severe osteoporosis with a history of fractures, talk to your doctor first. If you've got an acute back or neck injury, obviously skip it. And if you have uncontrolled inflammatory conditions, check with your healthcare provider before trying this. About 8% of people in the studies reported temporary increased discomfort when they first started. It usually went away within 3 to 5 days as their body adapted. But if you feel sharp pain, shooting sensations, or things get worse, stop immediately and see a doctor. One more thing. This routine is specifically for morning stiffness. It's not a cure for diagnosed conditions like advanced arthritis or degenerative joint disease. For those, this might help as a complementary approach alongside your medical treatment, but it's not a replacement. Here's what we covered today. Morning stiffness happens because of 4 things: thickened synovial fluid, facial adhesions, mild inflammation, and joint capsule contracture. The research shows a 2-minute routine of spinal waves, hip circles, and shoulder rolls with reaches is associated with real improvements. Do it within 5 minutes of waking. Do all 3 movements in sequence. Be consistent, aim for 6 days a week. Keep movements slow and controlled. I've linked every single study I mentioned in the description below. Full citations. You can read them yourself. I've also timestamped this video so you can jump straight to the exercises if you want to watch them again. Remember, this is educational information. Your situation might be different. Talk to your doctor before starting any new movement routine, especially if you've got existing health conditions. Thanks for watching, and here's to moving better tomorrow morning.